Hi, this is Dr. Srushti. I'm a pediatric ophthalmologist and squint specialist in Shekar Eye Hospital. Today I'm going to talk about importance of preschool screening for eye disorders. Many a times patients or parents ask us what is the right age to test our child's eye. In general, without any complaints, the preschool age group, which is nothing but 3 years of age, is recommended for screening, particularly for vision problems. In preschool screening, we screen importantly for refractive errors because those are the ones which may not come up with a symptom but the child will be silently struggling. We do school screenings in order to screen all children at around 3 years of age in order to rule out any sorts of vision problems. Importantly, in refractive errors, in very young children, we come across astigmatism or there can be early onset myopia. Hyperopes or the long-sightedness are another set of children who will have discomfort or difficulty in near focusing, and that also needs to be importantly treated. People ask, how do you test refractive errors in such small children? They don't even know how to read the vision chart. It is not necessary for a child to respond or read the vision chart. There are different ways of testing refractive error in small children. We can even test a refractive error in a small baby or a pre-verbal child who are not even able to talk. So there is something called objective refraction wherein we test the light reflex in the eye through a scope, the retinoscope, and depending on the behavior of the light reflex, we decide the refractive error of the child. And also 3 years of age has been set as a limit for screening because less than 3 years of age we don't always prescribe the glass power whatever the child has. This is because there is a rapid changes in the growth and development of the eye that is happening before 3 years of age. So under 3 years of age, there is a guideline beyond which we definitely prescribe, below which we observe or wait for it. If there is a parental history of glasses, it is definitely important to check your children because it is common for the next generation to get the similar kind of a refractive error. However, in special situations like preterm baby, the child who has had ROP or the treated for ROP, or the child has been having a developmental delay, in such special situations we do treat the refractive errors even at 6 months of age. It is important to encourage their brain seeing clearly in order to make them pick up their milestones faster. And hence in such situations we do treat it early, otherwise we generally treat it after 3 years of age. Beyond refractive errors, we also screen for other vision threatening problems. Importantly, the second most important condition we need to look for in preschool screening is squinting, because the deviated eye may not receive enough stimulus for developing vision, and hence it may end up in a lazy eye, which is called squint related lazy eye or strabismic amblyopia in our medical terms. And this squint related lazy eye is very deep, and in order to reverse the lazy eye it's very difficult, and hence it needs to be caught early and the lazy eye to be prevented. We look for any sorts of squinting. Even the small squinting needs to be addressed importantly in preschool age group. The other vision threatening condition that we look for is congenital cataract or developmental cataract. Although it is quite rare, it is very important for the vision development of the child in order to ensure that there is no cataract or even retinal disorders. Other than that, we also look for eyelid abnormalities or alignment abnormalities. This also can cause vision deprivation in a child. As the child is too young to complain of whether it can see or not, whether it is seeing blur, whether it is struggling to focus, so it is too young to complain. So screening helps us in picking up such conditions and treating it early. Overall, it will help the child to develop better in terms of its learning and even motor and fine motor skills along with the vision. For more tips to know about your child's eye and how it works, please subscribe to Shekar Eye Hospital YouTube channel and share it with your loved ones. Thank you.